Anne. Hi, and thank you so much for joining me for a discussion on Faces of Digital Health, where we are going to talk about healthcare IT in hospitals in Canada, the Canadian healthcare system, and investments in healthcare IT. You've got a lot of experiences with that. You're currently the Director of Clinical Applications and Support at the Women's College Hospital in Canada, and previously you were the Manager for Data Standards at the Canadian Institute of Health Informatics. So definitely plenty of information. And maybe just before we begin, we connected over LinkedIn, and you shared a little bit about your background and your experiences on the ground, on the front line in healthcare IT, and asked if you could share those insights with me. And I was very, very happy to see that, because I get a lot of pitches and a lot of suggestions for many, many great speakers, but it very rarely happens that women would actually do that. You know, they would pitch themselves for various reasons, I guess. So for all the women listening, just do it more often. Like, what's the worst thing that can happen? You get no response. The best case scenario, you're in a place like this. So, Anne, thanks again. You're an inspiration.
Thank you, Tessa. And it's so nice to be here. Thank you for having me on. And I completely echo your words. If you have even an inkling of something that you want to do, just do it. That's definitely been the journey that I've been on over the past couple of years. Shoot for the moon, and if you don't make it, you'll land among the stars, right? That's the saying that we go by.
Awesome. Since we are already in this very optimistic and positive spirit, I want to kind of slowly dive into the discussion by asking you, what are the 2 or 3 things that you're optimistic about when it comes to digital health and healthcare data in Canada? And maybe you can also give us a little bit of background around the topic for anyone that's, not from Canada or doesn't have any insights into the whole healthcare system.
For sure, yeah. So I'll start by saying I'm the vice chair of the board of directors for Digital Health Canada. This is a volunteer position that you get voted into by the membership of this professional association. We are the largest in the country, and so I might be a little bit biased in saying this, but I actually think that this community of membership is one of our superpowers in Canada. It gives us a platform to learn from each other and solve problems together and build towards our shared goals. And when you're in a country that's as vast as we are and as large as we are, with the big dreams that we have for digital health, it actually doesn't feel so big when you have this membership of 8,000 very tight-knit individuals in the digital health sector who are willing to collaborate whenever possible to help move the agenda forward. So I would say that's probably the thing that makes me the most optimistic, is this concept of community and continuing to kind of build it up across the country. And then the other thing that I'm very optimistic about in terms of digital health in Canada is just the innovation that happens here, where honestly our healthcare budgets are quite tight. We're a publicly funded system. So across all levels, the local, provincial, and federal levels of government, people are, kind of trying to make ends meet as best as possible within the healthcare space and within digital health. But we still find ways to get things done. And I think it's kind of, that saying, necessity is the mother of invention. And so if you do even like a quick scan of projects that are happening across the country, you'll find stories of really incredible creativity and advancement in digital health. So for example, we're one of a handful of countries that's working to progress national connected care or interoperability legislation. And the foundation of this is actually collective impact, which is another way of saying that interoperability is about more than just the technology. We're attacking this problem by trying to keep the patient at the center of the whole story. And that's the thing that I really love about the Canadian healthcare system. It always comes back to the patient. That's always the foundation of any of the work that we're trying to do in digital health or healthcare more broadly.
Mm-hmm. I was just reading a recent report by McKinsey Analysis that was actually done for this year, and it mentions that basically there's a lot of potential in Canada, as in many other countries, to use AI to decrease the cost of healthcare. If you look at the spending, Canada spends 12% of GDP on healthcare, which is quite high, not as high as in the US, which is probably at 20 or more percent at the moment, but still very high compared to many other countries in the developing world. And the opportunities to use AI in care delivery is with the use for clinical decision making, for public health, and more. So, how do you see this estimate? And what I'm currently interested in learning more about is what kind of funding opportunities or constraints do hospitals and healthcare providers have when it comes to introducing and testing out and adopting technologies such as AI? Because you started discussing standards, which is something that we're going to address, and that's basically the basis that you need to address when you want to really tackle population health and dig into the data on the population level.
Yeah, absolutely. There's so much opportunity to leverage new technology, not just AI, but other technology that will help us be more efficient across the healthcare system. We are starting to hear about pockets of examples where hospitals are adopting this, and it's to help not just with the actual delivery of care, but also for a lot of the administrative use cases, which often people forget about and take up a lot of time and effort. We spend a lot of money employing people to do some work that is maybe not as high value, and so we're thinking about in terms of projects that are being implemented across the country. I've heard that we're looking at these hospitals are looking at examples where you can implement or introduce this technology to start to digitize processes that are kind of very easy to automate because they're repetitive. And then those people that are spending time on that can be freed up to spend time on tasks that are higher value, and you're interacting more directly with patients or providers. And so there's lots of ways to kind of come at this. And I think that there's some really cool examples that we're working on at my hospital included. So looking forward to the future there.
The hospital that you're currently in, you started this position in early 2024. Before that, as I mentioned in the beginning, you were working at the Canadian Institute for Health Informatics. Can you talk a little bit about that transition? So you were recommending STARDA standards and the use of data in healthcare, and then you came into a hospital to actually drive the change. How was that? What surprised you? What were you suddenly up against when you took that role?
Yeah, for sure. I love talking about this because I think one of the reasons I actually took this, the role that I'm in now, is because it had both the data in and the data out sides of the data lifecycle under one portfolio. So most hospitals are too large to put all of this under one director, but we're able to at our hospital. And so it's really cool to be able to see where the data needs of the hospital are from a decision support and analytics perspective, and then be able to influence the quality of those data points that are used to do those metrics and calculate those metrics right at the point of data creation and collection within our electronic patient record. So I made the jump from kind of quasi-government organization into hospital because I wanted to understand healthcare data at its most raw and preliminary form. And being in like a fast-paced hospital is definitely the place to do that. And a lot of people will say that like you're kind of hit with the reality of how imperfect data is in healthcare and what a long way we have to go. But I'm like ever the optimist and always positive. And I'll say like after 8 months in this role, now more than ever, I'm convinced that we can get to a future where good data is the norm in healthcare. So that's data that's accurate and fit for use, reliable, timely, and comprehensive. But I do think that in order to get there, We have to be very deliberate in our deployment of projects, in all of our digital tool, in the implementation of all of our digital tools. We always have to keep data and how it will be used at the forefront when you're planning out your implementations and your projects and your design. So I've been in this role about 8 months, and I think my biggest aha moment is you cannot ignore the fundamentals, whether it's a countrywide digital implementation or just one small digital tool within a local hospital. The basic principles of IT, they have to be in place. So that's good governance, good training, and good workflow. And these are the things that people don't always talk about at keynotes and in conferences. Things like intake processes and prioritization frameworks and user experience and training and communication. But that's what matters at the end of the day. That's what's going to lead to sustainable process and enable our users to collect data in a way that's not going to add extra burden when they're already so burnt out. Like the healthcare providers of every country are facing massive administrative burden, asking them to collect more discrete data, more structured data, more clean data. It's heavy, but it doesn't have to be if you design your workflows properly and if you communicate and train properly and you design a good user experience for them. And I will say, so I did just return from, we use the Epic EMR at our hospital, and I just returned from their user group meeting. And there was a quote that they said in the executive address, and I just loved it. I wrote it down because it just speaks to this philosophy of working. And it was that it takes an ounce of consensus to make a workflow decision in the moment and a pound of consensus to correct it in the future when tens of thousands of people use it every day, no matter how bad it is. So it's worth the effort up front to correct and fix your workflow issues rather than letting bad workflows perpetuate and then lead to bad data that you collect.
In the last 2 episodes, I spoke with a consultant, and we had this really broad discussion about the importance of strategy and how to create a framework and a path to success when it comes to healthcare. And Mehdi Khaled mentioned that oftentimes governments, hospitals, institutions have an idea or very broad thinking about what they want to do, but they don't have the basis. So, for example, they want to implement AI, but they don't have a data strategy. And one of the things that you mentioned before this discussion when we were still online was that you noticed immediately this lack of workflows, which basically caused the data to be scattered in silos, unstructured. So this is the problem that you are now in charge of solving. So can you talk a little bit more about how you're going about that? Are you also just taking the time to design a broader strategy? How are you transferring that vision to people? Because you really got me thinking how people just get told what to do, just get told that they need to now gather more data, use more information, without potentially having a broader understanding of what's the end goal, what's the bigger picture. Yeah. So how are you going about all these issues?
Yeah, I wish I had a magical wand or an easy button I could push to solve all of this. I think it's a long journey, and it kind of takes, every day you need to kind of stick with exactly what you said, those principles kind of front of mind. This digital health is complex, and healthcare is complex, and there's lots of interests and players and needs, and it's very easy to just get lost in like the noise and caught up in trends and think that, AI is going to solve all your problems. But it's not, digital health is just so like fundamentally part of healthcare now. Our providers can't do their jobs without the tools that the teams like mine support. We have doctors that are graduating from med school today that don't know how to do paper charting. And so when digital health is so fundamental to healthcare and healthcare is so fundamental to humanity, we owe it to our industry to make sure that we don't forget the basics and we don't get caught up in the trends and the noise and try to find quick win solutions. Like it's hard work every single day that will get us to our end goal. We're doing a lot at the hospital that I'm at to try to live this every day. So one of the things that we're trying to put in place is a data governance structure, and we're very deliberately rolling it out in a slow way, because we want to make sure that people understand their accountabilities and their role to play in data. Like it's not something that's well understood. People don't always realize that, like, when you're documenting about a patient and that's forming their medical record, those are all data points that can then be used for so many different purposes to help with better decision making for clinicians, to help with better, operations of the hospital overall. And so helping people understand their role in this through kind of very intentional use cases. That's the approach that we're taking to bring data governance to life in our organization. We're also doing just some really fundamental things, like we're revamping our approach to training our healthcare providers to make sure that they are using the digital tools that my team provides to them in the most optimal way possible and in a standardized way. Because, they're busy people when they're in a clinic and they have patients and people waiting for them in the waiting room. They're not going to think about what's the perfect way for me to document this diagnosis. Where does it go? It's going to be the easiest and the fastest and the most accessible thing. And so we want to make sure that we're training them and learning from them at the same time to make sure we're designing our solutions to enable that data to be captured as easily and as quickly as possible. And then there's just, like the basic things that sometimes you forget about in the digital health space, like keeping your underlying terminology systems up to date. So all of our EHRs and EMRs are built on these classification systems that are provided by SNOMED and ICD and these large international standards organizations. And if you don't do the work to maintain them and do your updates and do your patches and do all of that, then you fall out of sync very quickly and you don't keep up to the practice of medicine. And it's an ever-evolving field. And so just keeping all of that in mind is important as well. And that's not to say that we don't have some really cool cutting edge projects, but I think the point I'm trying to make is that in all of the work that we do, whether it's our fundamentals or our cool projects, we take a very mindful approach to it at the hospital. Like we think about workflows and user design and evaluation and change management right at the outset when we're designing the project. And maybe, you can argue it slows us down a little bit, but I think it actually helps us build more sustainable processes and happier users at the end of the day, which is a win from my perspective.
If I would try to summarize, I would say that you opened up two very important topics. One is kind of the long-term approach to healthcare digitalization and how you're going to go about that. And the second is training and knowledge and digital health literacy. If I start with the first one, so the broader digital health strategy, I mentioned earlier that you said that instead of sitting on a gold mine of data that could further be used for analysis, for AI, for everything else, you are now sitting on a lot of unstructured and inconsistent data. How are you going to go about that? So, for example, in Europe, a lot of regions, cities, or institutions are going in the direction where you basically keep what you currently have, but start building new applications with potentially new standards such as open air to design a future-proof model where the standards that you put the data in are vendor neutral, are structured in a very clinical detail, and then slowly, because medicine is changing and clinical needs are changing, there's always this need for new software and new data capture, and going forward with this approach can bring a sustainable long-term model where eventually you are saving all the data in a structured form. So how are you going after that, and what do you think about these approaches?
Yeah, I think that these approaches are so cool. So in my previous life, I was working at CIHI, which is the Canadian Institute for Health Information, and that kind of worked at a federal level to bring together data and cleanse it. Actually, it came to us in a very clean state because there's a process that happens in Canadian hospitals and in a lot of U.S. hospitals as well, where you take the raw data in a patient chart and you codify it and structure it, and then you submit it. It also creates a very long time lag between when you can actually get that clean data and use it. And we were always thinking about like different ways of getting at that data in a more kind of real time or timely basis. And it was approaches like this that were very appealing at the time. And then before that, I used to work for a provincial agency called eHealth Ontario, which is now part of Ontario Health, which is essentially like a crown agency of the Ministry of Health in this province. And one of its responsibilities was to build a provincial electronic health record. So the golden record, or the single source of truth for patients that would connect all of their health records from all the different care settings that they've been to, plus the provincial kind of repositories of data on their health card, their demographics, and things like that. And so in those roles, I think my eyes would light up when I would think about these concepts of the open EHR and all of these other approaches to structuring data, regardless of what it's like in its kind of native format. But in the seat that I'm sitting in now, in the role that I'm sitting in now, I think that I have an obligation to do whatever I can possible to try to clean the data as much as I can at its point of creation and collection. So I have the privilege of leading a team that literally supplies the digital health tools to doctors and nurses and medical secretaries. And, we're kind of doing the painstaking work now of mapping out our workflows from the time that a patient is referred to our hospital up until the time that they're discharged. And like, what are the data points that we capture along the way at each point that we interact with them or that they interact with one of our digital tools? And we're thinking, and it's a long, painstaking process, but we're thinking about, is this the right time to ask the patient this question and gather this data? Is this the right provider, this nurse or this secretary or this physician that's gathering the data? Can it be done by someone else? That can then create efficiencies downstream. So it's really cool to do this kind of work and think about data in this way. And hopefully all of this effort will actually help with those broader efforts provincially, federally, globally to get to more clean data. Because I do think it's important, like regardless at the local level, it should be as clean as possible.
Sounds like a lot of data to basically map all that out and try to do a broad analysis on where you could improve efficiencies. How long do you think this will take? I'm not sure if this is a silly question. When I started, when I started in healthcare IT, even before I started in healthcare IT, when I was still a journalist 10 years ago, I once spoke with a healthcare IT specialist, and he said that they're optimizing workflows. And I said, well, what are you going to do after you finish? It's like you optimize and that's it. Now I know that's a silly question.
It's not actually. It's a question my steering committee asks me every time we meet with them. So when will this be done? But we're actually like breaking the patient journey into kind of manageable chunks, and we're tackling things. So we're starting with registration and check-in. So we're tackling things in smaller chunks so that we can roll out, the best practice and training and all of that other stuff that we love to do with our projects. I don't know that it'll ever be done. There's so much scope to kind of keep improving, keep optimizing, keep standardizing. So, yeah.
Yeah, I guess as long as you at least measure and can compare the before and after effect, that's good, because that's often the challenge, that either hospitals don't take time to actually compare the before and after state of introducing digital tools, or they do that, but they realize that the baseline data where they were just capturing or analyzing data once a week is not comparable to something that's now continuously being updated. So what are you doing in that sense?
Yeah, for sure. So we actually have an evaluation plan that's kind of running in tandem with this project. And so we're capturing the pre-intervention data, and then we'll be doing the post after we've trained in this particular phase of the project. We're focusing on our medical secretaries and what they do at check-in. And so we'll capture the post and make sure that we're actually improving efficiencies and improving their experience as staff at the hospital. We want to make sure that, they're feeling like there's value in this work and in the digital tools that we're supplying to them. And the reason that I said that, this will never be done is because, like, as we run through this project, everyone gets like more and more ideas about, we can apply the same approach to all the nursing workflows and all the physician workflows and all the surgeon workflows. And so there's so much in healthcare. Like, it's a never ending journey. And I totally agree. Evaluation is key, is super important.
I love the fact that earlier you mentioned all the classifications that exist in healthcare and the mapping that needs to be done, and the fact that SNOMED is getting updated and you need to be up to date with those updates. And at the same time, you also said how challenging it is for new clinicians to get into clinical practice and start using these digital tools. So we often talk about the need for upskilling the workforce and kind of increasing the digital health literacy, but I don't think we talk often enough. What does that mean? Like, I often thought that, doctors should just know more about the technology and the technology trends, but now I'm thinking that what exactly is, digital literacy? So in your view, what do you think are kind of the subjects or the things that doctors should know about? Should they be taught about the ICD codes, about SNOMED, interoperability, just the use of the software that they need to use so they can use it properly, and don't create garbage data. So what would be kind of the three things that you see are missing in the education of clinicians or nurses when we talk about digital health literacy or healthcare IT literacy?
Yeah, that's such a good question. And it's so interesting. I was just talking to our CMIO yesterday about this idea of cognitive overload. And like, sometimes we forget in IT that, providers, healthcare providers they're there to take care of patients. They're not there to be experts in IT and digital and any of that. I think that with kind of the younger generation of practitioners coming into the field, they're going to be just more aware of digital tools, and the literacy will kind of naturally increase. But it's not their job to know about interoperability and what an ICD code is. That's why our teams exist, to make it as seamless and easy to use as possible for them. We're always going to need our champions, the people who do get it a little bit more and who are just naturally more interested, and we can kind of work hand in hand with them to design out these experiences so that it is as optimal as possible. But I think that literacy has kind of different tracks. Like, there's what you need to know as a provider, and that's really just how to use your tools in the correct way, in a standardized way, in a way that's resulting in good data, and that's making sure that you're meeting your medical legal obligations. And then there's the literacy that informatics teams need and IT professionals need. And, it's that in that space, it is important to understand why terminology systems are important and what interoperability is. And I would say, like, maybe this is just a Canadian problem, but there's a lot of scope there to increase that knowledge and have people kind of see how all these pieces come together. And so I always encourage anyone that I kind of run into is to, just learn, get involved. There are plenty of international organizations that operate on a largely or advance their mandates through largely like input from volunteers. In Canada, as small as we are in comparison to the US in terms of the size of our digital health industry, we're actually quite a force on the global standards stage. So we're involved with organizations like ISO, HL7, SNOMED, ICD, and we have groups of volunteers who spend their free time just kind of bringing together the coalition of the willing and collecting input on the latest standards, making sure that they're fit for Canadian needs, making sure that we're keeping up with evolving, practices in medicine. And then we join council meetings, we attend webinars, we kind of keep ourselves in touch with those parts of the industry. And I would say, like, anyone coming into this digital health profession should be doing the same. And it's something that we always encourage and educate through Digital Health Canada as well. It's just keep on top of your profession and your practice, because that is what you need to do in order to design those tools that will help the providers do their jobs and practice to their optimal efficiency.
I love that point because with digitalization, what's increasing is also the number of people with technical expertise, and especially in healthcare. One of the reasons why software is developed really slowly, why we've got such a challenge with the workforce, is because the best case scenario is that you actually have a clinical person that also understands IT. So that's kind of where I see the challenge when we talk about digital health literacy and workforce shortages, because the technology is developing so fast, and just cybersecurity needs, for example, are increasing so much that you really need kind of these two profiles combined in one person, and a lot of these people with these two profiles. So what do you see on the ground in that respect? What kind of challenges are you faced with? Just
Yeah,
feel free to
a
share.
it's a great question, and I would say like they're like the unicorns of informatics, right? Someone who understands the clinical side of things and the IT space, and like I wouldn't hold my breath for too many of those. There are definitely some physicians that I've come across who know technology in like a much deeper way than I ever will, and I really admire how much time they can spend to get to that point. But where, like, for the most part, you're not going to find that within like a hospital or a care setting. And I think the power really is in collaboration. So I work so closely with my CMIO, and the perspective that she brings in terms of like her day-to-day clinical practice, and the expertise that she does have with use of the digital tools that we provide. It's invaluable. It's things that I would never think of. And just having that kind of second person to talk through things with I can't say enough about how much that's needed for an IT team within a hospital. And there have been times where, we're communicating a change that we're rolling out to the hospital, and I'll write up like a draft communication and run it by her, and she'll kind of flag things like jargon to me that it's just so, like, I like to think that I'm careful about this stuff, but it's so embedded in our brains and our day-to-day lives that we don't even see it anymore. And she's like, the clinicians aren't going to understand what you mean by this. Like, you need to simplify this language, and if I didn't have that second check, like, it would, our communications probably wouldn't be as good as they can be. So I would say, like, know where your weaknesses are, and then find the people that are going to be your strength, to combat those.
Absolutely. It's when you are in such deep expertise as, either healthcare, IT is, or medicine is. I mean, doctors also use jargon. You go to a medical checkup or a medical exam, and the doctor says everything's fine, and then you get the actual discharge letter, and it's full of jargon that doesn't really sound that fine as the doctor said it was. But I also actually just wanted to very briefly comment. You reminded me when you said that, it's important to have that clinical perspective and that on the ground perspective from the clinical practice. I once spoke with a nurse that started to specialize for digitalization, and she said that she's still working in clinical practice once or twice a week because she wants to be on top of the changes that are happening. And I thought to myself, what exactly is, changing that much? Like, doctors treat patients, nurses, like, how much does a work of a nurse change in a year because from a software perspective? But actually, like, software and EHR is just one little piece of technology that they're using. There's the infusion pumps, new monitoring devices, like all sorts of things that we are expecting them to know how to use, but that's not easy at all because you have to learn each of that things. So that's also, I think, one of the aspects of complexity that we often don't talk about or forget when we just talk about the need for upskilling and the demand of just technical knowledge or affinity to technology for healthcare providers.
Yeah, absolutely. I feel like you're living in my brain and like reading my mind right now, because that's exactly what we talk about. Me and my CMIO talk about all the time. She's an endocrinologist, and she's always telling me about, like how fast the technology is changing with their glucose monitoring devices. They've got everything is now wireless, and you can control your glucose dosage and insulin dosage on an app. And like to keep up with that is, think about how much is like the cognitive burden is on providers that are having to keep up with those changes. Plus, we're rolling out a new form that you need to fill in your EHR today. Like it's a lot. And so we owe it to them to keep it as simple as possible and make it, as consumable as possible.
Mm. And we didn't even mention all the new medical procedures or new things in just medications and therapies that they also need to be aware of and understand very well. So, if anything, I think we outlined the complexity that healthcare providers are under. One thing that's also very important here is the cybersecurity part. As you mentioned, the wireless devices, the seamless data flow has potential vulnerabilities. So where do you see the biggest challenges? Did you already see a cyber attack in practice? How are you preparing for the time when that might happen? Because with cybersecurity, they always say it's not about if, it's when it's going to happen. So how are you kind of mitigating that potential danger?
Yeah, that's a good question. It's something that we cross our fingers every day that we don't have to experience, because I think it would be painful. Yeah, like I said earlier on in this interview, like it was digital health and healthcare are just the same thing now. They go hand in hand, and trying to practice medicine and doing your documentation without having access to your tools if they've been taken down by a cyber attack, like it's next to impossible. So we're going through the process of, planning what we would do in the event of an attack or a downtime. And like the amount of effort that it takes to think back to the days when we were using, paper charts and paper forms and printing labels, like it's not an easy thing to do. And I think it really makes it so obvious how far we've come. Whenever you're feeling down about our progress with digital health, it's great to just sit in on a business continuity planning meeting or something like that, and you'll realize oh right, we've actually digitized so much and made things a lot easier in so many ways. But yeah, we're going through that planning like many other hospitals are doing right now, and making sure we're doing tabletop exercises and drills and kind of role playing as much as we can to make sure that everyone understands their role if this ever happens, and we have access to a kit of material that we can lean on to try as best we can to make sure we can keep caring for our patients. And if we have to shut down anything, we have a plan for that as well. But it also kind of makes you think about just how big this job is, like when you're documenting on a paper chart and then you're back up and running on your system, you then have to restore all of that data into your system. And so now who's going to take that on? It's a big piece of work. And so it's not a simple kind of process or plan to put in place, which is why I think it's taking hospitals a while. But it's good to kind of have these reminders in our day-to-day lives when we hear about cyber attacks to make sure that we're on top of it and we're not letting something like that slide. It's very important.
You actually just gave me an idea for a new episode, which would be focused on business continuity, because we're so focused only or centered on digital and software and cloud, that I think the broader public isn't really aware of what business continuity is. I happen to run a user group of hospitals in the UK and Slovenia, where we basically discuss various challenges related to medication management in the hospitals. And I remember how surprised I was when we were discussing business continuity, and it basically comes down to counting the number of printers you have, having posters on the walls with like key points on what happens if the connectivity is out, if electricity is out, counting the numbers of sockets that you have on the board, so you know where the computers are going to be connected to, so they are always fully charged if just an electricity blackout happens, and laptops will still work, and things like that are just fascinating to me because it's far from digital.
For sure,
And knowing
yeah.
who to call. Yeah.
Yeah, but like we said at the start, like it's part of the fundamentals, and it's like you could never just kind of implement something and forget about it when you're in the space. And it's the same thing with your downtime procedures. Like if you have dedicated plugs where you're going to plug in your downtime machines, like you have to check them on a regular basis to make sure that they haven't been used and haven't been take it. Like we found that in our checks, like people will forget and they'll use our emergency plugs when they shouldn't be. And you have to stay on top of it, just like you have to stay on top of your training with your digital tools, and you have to stay on top of your communications, and like it's a never-ending job.
Yeah, absolutely. Perhaps just one last question before we wrap up the discussion. Based on all your experiences in driving the guidelines around data governance and data management, and now your role in trying to implement that and structure the unstructured data, what would be your advice to hospitals that are faced with legacy systems, vendor lock-in, and have a really hard time to make all the data that they sit on useful? How do you think is the best approach to go about that? Obviously, it differs based on the institution, the vendor that you work in, but is there any advice that you can give in the general sense?
I would say we've come across this same problem at our organization, and I would say that there's always a solution. You just have to, it might not be perfect. You might not have your data right away and in the best format that you want it, but there's always a way from a technical standpoint to solve a problem. And I think maybe the kind of general advice that I would have is if you want to solve your technical problems, you can only really do that through good relationships and good partnerships and good collaboration. And so like take the time to invest in your relationship with your vendors and your relationship with your clinicians. And that's what's really going to help you get to solving your technical problems when they seem unsolvable.
Which I would say is also a call to action to vendors to, if they're not doing that yet, work more closely with clinicians, because it's going to have a massive impact on both parties, and it's going to ease future software development as well as increase the customer satisfaction.
Sure, totally agree.
And thank you so much for the discussion today. And I will definitely check up on you in a year or so to see how far you've come with that optimization, and if they stopped asking you yet whether you're done or not.
Thank you so much. This was lovely.